And joining us for this week's Your Health segment is Dr. John Olson, professor and vice chair of the Department of Surgery at the University of Maryland School of Medicine and head of general and oncologic surgery at the University of Maryland's Marlene and Stuart Greenebaum Comprehensive Cancer Center. Doctor, thank you for being with us.
Thank you very much, Jeff. It's great to be here.
Good to have you. We want to focus in on the thyroid. Which is something we all know we have and maybe aren't 100% sure exactly where it is. So let's start with what it does.
Sure. The thyroid is one of the glands of the endocrine system, meaning that it exerts its effect on the body indirectly through the hormones it produces. These hormones circulate and control all of our physiologic processes, including our heart rate, our blood pressure, our sense of temperature, even our metabolism and weight.
Why is it where it is? Any idea?
Well, it's complex embryology, but it develops in association with the other structures in the head and neck, and so it resides in the neck, at the base of the neck, between the Adam's apple and the top of the breastbone.
How often does it become cancerous?
More often than you might think. It's one of the more common cancers. That being said, it's not as common as the ones that we commonly think of. In the United States in 2016, it's estimated that about 65,000 Americans will be diagnosed with thyroid cancer. To put that in perspective, that's about a fourth as common as breast cancer or lung cancer, about half as common as colorectal cancer, and on about the same frequency as, say, melanoma.
Prevalence is higher among women, I read. Why is that? You know,
that's one of the great mysteries of our field, Jeff. It's very clear that it is a disease of women predominantly, although men do get it. But the ratio of 3 to 1, depending on what you read, suggests that there might be a hormonal contribution. But really, despite science's best efforts, we still do not know why women are diagnosed with thyroid cancer more often than are men.
How does it tend to be picked up? What's the first sign?
Well, sometimes the most common sign is absolutely no sign whatsoever. And in fact, the patient often will be getting a physical exam from a primary care provider. Sometimes they'll feel a lump in their neck, or someone else will feel that, and that will trigger a series of investigations that try to figure out what the source of that is. And so it commonly presents as a nodule in the middle of the neck.
How is it treated?
Well, first of all, I think the important thing is to diagnose the situation, because thyroid nodules are incredibly common. I say to my patients, thyroid nodules are about as common as gray hair. The older you get, the more that you have. And about half the population has thyroid nodules. And you can imagine, with only 65,000 of these a year in our country, the vast majority of the nodules are in fact benign and need nothing other than reassurance. And so to do that, there's this, to make the proper diagnosis and then initiate the proper treatment, a series of investigations need to be done. And that starts with an assessment of function of the thyroid by a simple blood test, and then more often than not, the next step would be an ultrasound of the thyroid to characterize the nodule, and then the ultimate step in diagnosis would be a fine needle biopsy to sample the nodule for the cells that it contains, and under the microscope, the pathologist can tell whether that nodule represents cancer or a pre-malignant lesion.
These nodules, there's something that a doctor can feel. Can a patient feel that there's something there?
Sure. If they reach sufficient size, or if the patient is sufficiently thin, you can feel them. A common scenario in men, obviously not women, is a man shaving can feel it in the neck, or in a woman's case, putting on a necklace or something like that. They can detect a nodule.
So is the nodule generally left alone?
Typically, if they become a certain size, or if they produce a symptom, some people feel it when they swallow, or it, causes a pain or maybe even a change in voice, then those really need to be looked at seriously for treatment. But the vast majority of nodules that are biopsied and are benign can be observed with repeat ultrasound.
Let me remind our viewers, if you have a question about the thyroid or thyroid cancer, or nodules, give us a call. We'll have the number on the screen. Tweet your questions to @MPT News. So when it comes time surgically to do something, what are the options?
Well, so when surgery is indicated for thyroid nodules or other thyroid conditions such as goiter, it's important to find a surgeon who has expertise in this area. The thyroid, because of its location, is in a somewhat high rent district in the neck, and so there are important structures to make sure that are left undamaged as the thyroid is removed. And in most cases, thyroid surgery, like many complex operations, experience matters. And so a surgeon who is dedicated to endocrine surgery and does a number of these across, when looked at statistically, your chances of successful outcome are better if you tend to go to a specialist. So, and once that's done, the surgeon would meet with you and perform a standard history and physical and the usual workup, and then talk about surgery.
What are the odds for a successful outcome?
Oh, well, that's the good news and all. Despite the increased incidence, thyroid cancer, when properly and appropriately treated, is highly curable. The survival statistics at 20 years for thyroid cancer, for the vast majority of them, have over 95% survival. And so when properly treated, thyroid cancer, caught early, properly treated, is very curable.
What's the role for radioactive iodine in this treatment?
Radioiodine is an adjunct to surgery for select cases of thyroid cancer. It performs a couple of functions. It augments the ability to monitor the situation after thyroidectomy, to test for recurrence. It also treats micrometastatic disease that could be in surrounding lymph nodes that the surgeon does not remove. And we know that this is one of the great stories of leveraging biology for therapeutic advantage, is to put in a radioactive molecule that the thyroid normally takes up to, in fact, kill it. And so that is a very effective strategy for microscopic disease.
Lastly, for people who have had their thyroid removed, how do you get through the rest of life?
Common question. So the wonderful thing about thyroid is that we have figured out how to synthesize a synthetic hormone, make a synthetic hormone, and so it's one of the most commonly taken or prescribed medications that we have, and taking thyroid hormone replaces the function completely.
Very good. Dr. John Olson with the University of Maryland Medical Center and the University of Maryland School of Medicine. Doctor, thank you very much.
Thank you.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.